So, Dr. Allison House, a distinguished general dentist based in Phoenix, Arcadia at the House Dental, stands out in her field. Her exceptional contributions span state and national levels. She served as the youngest ever president of the Arizona Dental Association, establishing the Women in Dentistry program and earning Mentor of the Year and Dentist of the Year accolades. She doesn't age. I've seen her today. Nationally, Dr. House is an Arizona delegate in the House of Delegates of the American Dental Association, actively engaging in the Tooth Party Political Action Committee. She recently concluded a 4-year term as the ADA 14th District's representative on the ADA Council for Dental Practice, where she addressed workforce challenges. That's very hard to get up there. Wow. An accomplished speaker and author, Dr. House shares her expertise through the ADA Success Program and has co-authored a chapter in Innovative Women in Healthcare, highlighting her passions for dentistry and Olympic weightlifting. She also co-hosts The Authentic Dentist, a thought-provoking podcast that empowers dentists to navigate challenges and grow as resilient leaders. Through her philanthropy, she has efforts that extend to various causes, including the Arizona Dental Foundation and the Arizona Mom Mission of Mercy. In her personal life, she is a dedicated spouse, mother of 2. Her achievements in dentistry and her commitment to community service make Dr. Allison House a remarkable and inspiring leader in her field. She also has one precious corgi, Pebbles, who is living her best international life with her daughter in Germany. Dr. House.
Thank you. Thank you so much for having me. I really appreciate it. I'm honored to be here. And wow, what a nice introduction. So thank you. So I'm going to talk about courage, ethics, and leadership. I do a lot of discussions about ethics. Do I have a, okay. So let's go ahead to the next slide. How do I, got it. I think she introduced me. I just said I'm a solo GP, 23 years in practice. I've owned my own practice for 21 years. I have 2 adult children. One of them lives in Germany. She's married and she lives in Ramstein. Past president. So I've done a lot of really cool things and it's just been a huge blessing. And a lot of it is because I have so many great mentors, people who poured into me, cared about me, and taught me how to do things. And I'm always grateful for that. Talked a little bit about my podcast, The Authentic Dentist. So we started that in 2019, and in 2020, it was really an adventure. So I was on the Council for Dental Practice, and so we just talked about all the ethical issues that happened in 2020 on that podcast. And then we just moved into being authentic and talking about dealing with patients. It's been a lot of fun, so check it out. It's on iTunes and Spotify. Okay, here's our plan for today. I'm going to talk about what does it actually mean to be ethical, and I would love some interaction. I don't like to just stand up here and talk by myself. We're going to talk about a framework to make difficult decisions. We're going to talk about how to set yourself up for success, and if we have time, we'll go through a few examples. All right, so what does it mean to be ethical? And this is a question. What do you all think? What does it mean to be ethical? It's a hard question. Doing the right thing. When no one is looking, yes. What else does it mean? I agree, being able to sleep at night. What does it mean to not be ethical? Not have values. I like that. What else?
Anything for a buck.
Yeah. Acting outside your values. Yeah, yeah. So whenever I think about ethics, I always think about Enron and, these big companies that have done something terrible. But I always wonder if, maybe it's not quite that cut and dry. Maybe there's, you can veer off and all of a sudden you're out in left field and you don't even know how you got there. Do y'all know who this is? Hey, a lot of people don't know. Elizabeth Holmes. What do you all know about her? Theranos. What else do you know? Oh, okay. She is in jail. She had a blood test that said she could do DNA blood testing, and it wasn't true. Yeah, she took millions for this startup. And startups fail all the time. That's not the big thing. The big thing is that she lied. Sorry, we're having a little technical difficulty here. All right, so she started Theranos when she was 19 years old. She dropped out of Stanford, and she told everybody that she could take a drop of blood, put it into this machine, and she could get all this information. Only it wasn't true. Now, lots of startups say that they can do things they can't necessarily do, but when it comes to proving it, you actually have to prove it. Well, she lied. And she lied one time. And I think she lied the first time when she was 21 years old, which I get. 21-year-olds make lots of mistakes. They're not always thinking about things. But then she doubled down on her lie and kept going. And that's where I think the ethics come in, where in order to cover one lie, she did more lies and another lie. And then pretty soon she's out in left field telling people she can predict cancer 17 years before it happens with this drop of blood that doesn't work at all. And she's in jail. And it was interesting, I think, because CMS is what actually brought her down, which is a board where they went in, they checked, and they found that she was giving false results to patients. Yeah. But the most interesting part about that is still, she made one mistake, and then all of a sudden she's out in left field. And I think that's easier to happen than we think it is. So the first rule of holes, went in one, stop digging. There was also a culture at her startup of secrecy, where people weren't allowed to share information, and I think that contributed to the ethical dilemmas. How did everything get so bad for her? All right, so this is my dad and me, obviously a few years ago. He adored me. I have always felt so blessed that I had a father that loved and cared about me and poured into me. And as I got older, I realized that not everybody has that, and what a true blessing that's been. So he was an Olympic weightlifting coach, an international referee, and so I started lifting when I was 6. That was just required, and so I've lifted my whole life. And he told me that I needed to play big. If you don't know what you can achieve. You have to try. And yeah, you may fail, but what if you don't? What if you succeed? So what does it mean to play big in dentistry? Can you all think of things that make you play big in dentistry? I know it's a big question, so I'll tell you one thing. There's 4 of us that are playing big today as we stand up here and talk. And there's a time when it was really hard to get up in front of a group of people and talk. I would say that you're playing pretty big, doing some things, yeah. I think even trying a new procedure might be playing big. Just things that you didn't necessarily learn in dental school, but you have to move forward and keep trying. Anything else you can think of playing big?
Buying new equipment, and you're like, I've already $60,000.
Buying new equipment, learning new equipment, absolutely, that's part of playing big. Yeah. All right, so I'm just warning you, there's a lot of weightlifting in this. It's a big piece of what I talk about because weightlifting is a metaphor for life. My dad was always giving tons of, if easy, everybody would do it. He had just so many things about weightlifting and life. So there's going to be a lot of weightlifting as part of this. So there's a tension between playing big and ethics. When you buy that new piece of equipment, you have to use it. But what if the patient doesn't need those procedures? What if you learn a procedure, but this is the first time you're going to do it on a patient? That's a little scary. And there's an ethical dilemma of, am I ready? Do I have all the information? So there's this tension, and yet you kind of have to do it. So how do you do those things in an ethical way? How do you play big in an ethical way where you're taking care of yourself and your patients and your life, really? So what is the magic formula? Anybody got anything? All right, so we're going to start with the medical framework. And you all know this. 5 rules. Do no harm, patient autonomy, do some good, be fair, be honest. So do no harm, we always hear this. That's in every movie, every television show about medicine. Do no harm is your first rule. Patient autonomy, I think, is a little more difficult, and especially in dentistry, because patient autonomy means you gave the patient a choice, that they knew what was going to happen to their body and they agreed to it. And that's kind of sticky because sometimes it's really hard for people to understand what we do and how we're going to help them and what are the consequences. And it's easy to play them down, too. Do some good. Obviously, we want to do something that's going to help our patients. It's going to take care of people. Be fair. And the being fair, I think, is being compensated appropriately for your work, compensating people in your office fairly, putting true things on the insurance forms, being fair, and then being honest, telling the patient, hey, if this doesn't work, this is what's going to happen. And I think those are all things that we know, but in a busy practice, sometimes I think we forget. So I'm going to change these into some questions because this is how I think about a lot of things in my life. I use this medical framework, and I change it into questions. So when I have a decision, any decision, the first thing I think of is, will it harm someone? And that's in any way, financially, emotionally. If something I say is going to harm someone, I'm going to think about it before I say it. So the second thing is, did I give people a choice and full understanding? And again, sometimes this is just even with my kids. Did I really explain what's going on here? Do they understand what's going to happen? The third thing is, will it help people? And people includes me. I think that's an important question whenever I'm making an ethical decision. Am I being fair to everyone involved? And that's really complicated to think about. Am I being fair by not letting my kid do this because I don't want him to? Am I being fair to my patient? I'm sure you've run into all of these things before. And then am I being honest with everyone, including myself? And that's kind of the procedure one. Am I being honest? Do I really know how to do this? Or am I just dying to try this? That honesty, not just with other people, but with yourself. It's a good framework to think about. All right, so this is a little more interaction. Number 20. Now, dentists get this. Other people don't. This is not fun. So 20 is tested positive for irreversible pulpitis, needs a root canal. Who wants to do that root canal on 20? Hey! All right, so that tells me you've had some extra training probably to handle that. Why don't you want to do that? Why don't the other people in the room want to do this? Out of my scope of expertise. Okay, so running through the questions, what does that mean? Will it harm somebody if I do that root canal? Yeah, so I don't think that I can't navigate that. There's no way. So I think that I'm actually going to harm somebody if I try and do that root canal. Am I going to do some good? I don't know. I might get them out of pain for a bit, but I don't know if I'm actually going to solve the problem. What are the other questions? What about patient autonomy? That's a difficult one to explain to patients. I need to do this root canal. You've got to get out of pain, but I can't do this. And they always ask you, well, why not? And if you do that, you do this root canal, you're not good at it, you have to explain to the patient what the risks are if you're the one that's going to do this. And probably, even if you're an endodontist, you've got to explain to them, this is not an easy one. This may have problems. Being honest, being fair. Is it fair if you do this, even though maybe you charge a little less than the endodontist? It may not be fair because they're probably going to end up having to have it redone. Well, in my case, they're definitely going to have it redone. I'm not going to do that. So these are the questions that I'm running through before I do something. Anybody even know what silver points are anymore? I always think about that when I'm doing something new, that I never want to be the dentist that is still placing silver points and amalgams with pins. But at some point, we had to move forward. We had to try something new that we had never done before. We had to learn a procedure that we'd never done before. So we're not doing this with silver points anymore. But that's still a leap. It was still a leap to move into that. And anytime you're doing something new, a new implant procedure, anything, you still have to know what you're doing and you have to think about all the questions. All right, so I want to hear this. To crown or not to crown? What do you guys think? Not to crown. Okay, so why? There's not enough tooth structure left. Okay. What else? Yes. Crown to root ratio is not good. Crown lengthening is probably not a good choice. What else? That root canal doesn't look so great. Yeah. The patient really needs to understand why we can't save this tooth. Anybody willing to crown that tooth? Somebody. All right, so what if I told you this patient was 98 years old? Then you might do something different, huh? What if I told you this tooth had been like that for 6 months and this patient never ate on that side? There's some things to consider. It's not quite as cut and dry anymore, huh? So now we're going to do a little moral philosophy. And people have been debating about this for like 2,000 years. It's okay to disagree. There are two principles that I think about when I think about moral philosophy. And the first one is moral particularism. And what that means, it's the theory that an action is right or wrong depends on the details of the particular situation. And that's what we're going to call professional judgment. So whenever I'm looking at something, I'm looking at not just the x-ray, but I'm looking at the person in front of me. You know, what's their hygiene look like? I'm looking at my skill set. It's not just quite so simple. We ran into this in COVID a lot, where there was a lot of debate about offices being open and what your office should look like. And what I found so interesting is there was never a discussion about, well, who are you treating? If your whole office are kids, it's probably a different analysis than in your entire office are people from the nursing home. There's some differences in the way your office runs versus somebody else's office. If you're a oral surgery, you probably have some things in place that maybe the orthodontist didn't have in place. So it wasn't quite as simple as we're all going to do this across the board. It also mattered where you lived. So the professional judgment is important, and I think sometimes we judge other people without knowing all those moral particulars. The second one I always use is virtue ethics. The theory that an action is right or wrong based on how moral or virtuous the person is that I'm thinking about. So with that tooth that needed the crown, I think about Dr. Thompson. What would Dr. Thompson do? I'm sure there's somebody in your head that you're thinking, I wonder what Dr. Greer, Dr. Farmer, there's somebody that you're thinking, what would they do in this situation? Do you find that's true? And do you find that they're always right? I found that as I get older, they weren't always right. That sometimes I have to rely a little bit more on my judgment. But I do think it's important that we pay attention to who are we following, who are we listening to, and are they actually the most virtuous person? Are they actually people that care, or are we just following blindly in the footsteps? And I can tell you that in the case of like Dr. Greer from my dental school, I loved him, but he would be like 100 years old now. I don't think that what he would decide would be necessarily what I should decide in 2023. Okay, so this is me weightlifting. It was more than a few years ago because I'm in a competition. And this is one of the things that my dad would always talk about. Comparison hurts you. Being better than is really always a losing proposition. And that's those moral particularisms things. Keep your eyes on your own platform. So in weightlifting, you're on a platform all by yourself. The weight is in front of you, and it is your job to lift it. It doesn't matter what's happening on the platform next to you. It doesn't matter what's happening down the hall. It only matters what's happening on your platform in that moment. What can you do? And I think that's really powerful to think about, that we're not paying attention to the other platforms, because I don't know how much somebody else weighs. I don't know what category they're in. I can only do what I can do in my space. And it's real important to keep that in mind, especially when I'm making ethical decisions. So the other thing I think about all the time is we make 1,000 decisions every day as dentists. You know that, just little decisions all day long. 900 of them are probably correct because we are dentists. We've had all this training, this continuing education. There's all these boundaries. So we're making about 900 good decisions. 50 more are probably correct because of I'm paying attention. So on days that I'm not paying attention, that's not good. But on days that I'm paying attention, 50 more are probably correct, and I cared. That means that 50 of my decisions every day are not correct. And it's just true. I mean, statistically, we know it's just true. 30 of those incorrect decisions get caught right away. Like I seat a crown, it looks perfect on the x-ray, patient comes back 6 months later, I take an x-ray, there's an open margin because the x-ray was not lined up properly, or I just made a mistake. I mean, it just happens. But I fix it, no problem, we move on. 15 of these mistakes, they don't matter. Patient dies, he's 98 years old. Nobody ever even knows that the crown was going to break in 6 months. But 5 of these decisions, 0.5 of my daily decisions matter. They're wrong, and they won't be caught for a long time. And that just means over a lifetime of 40 years of practice, the last 5 decisions are going to add up, and at some point, it's going to be a problem. And this is just true for everyone that practice. If you live, if you practice, you're going to make a mistake or two. How do you handle it is the ethical piece. So when I read these things, I'm like, oh, never mind. I'm just going to sell the practice. I'm going to go do something easier for myself. It's a lot of work, but I don't want to go home and give up yet. So how am I going to keep moving forward? How am I going to play big? And how am I going to make good decisions? This is supposed to be a picture of Creed at the bottom of the pool. I don't know if you've ever seen Adonis Creed. I love that training scene from Creed 2, but I couldn't find a good picture of him. All right, so how do you set yourself and your office up to be ethical? So it's not just you that has to make all the decisions. If everyone around you is making unethical decisions, it's really hard for you to be the lone wolf all by yourself. So how do you set yourself up? Oops. All right, so the first thing I always think about, and again, lots of weightlifting, how can you get yourself in the right frame of mind? And there was this TV show called Lenox Hill. I don't know if anybody saw it. It was a great TV show. And it talked about these neurosurgeons in New York. So these neurosurgeons do very detailed work. And part of what they have to do in order to perform at that very high level is that they all had a religious practice. And so they would meditate or pray before they went in to work on somebody because that grounded them. They were very regimented in what they ate. So they made sure they ate before surgery, they ate their breakfast, they had their coffee, whatever they needed to do to be ready for surgery. They had enough calories during the day. Sometimes it's a problem. I don't drink enough water sometimes during the day because I feel like I'm running. They slept 8 hours every night. They made sure that they slept 8 hours every night so that they were prepared for the surgery the next day. They all exercised every day in some manner. And they all took some time off to be with their family, to read, to study. And I'm listening to this and I'm going, oh, okay, so that is a big piece of being ethical. Not being tired, not being hungry, not being in a situation where I'm exhausted and I just have to get this over with and move on. It's being prepared for whatever's ahead of me. And those Lenox Hill neurosurgeons, I thought that was really powerful to think about. And it's something that it's simple and we all know it, but do we all do it? Not always. So this is my dad when he was a young person. I think this is 1958 here in Phoenix. You have to decide who you want to be before you can actually become that person. So I love this picture of my dad, but this doesn't have anything to do with my dad. There was this great story. Mark and I, my husband and I, are very involved in weightlifting, and we coach kids in our garage. So I have my garage has never had a car in it. It's filled with weightlifting equipment, and I have kids come in and we train them in Olympic weightlifting because weightlifting is a metaphor for life. So this is not a kid that I trained, but she came in, and so I've met her, and she got invited to the Olympic Training Center, which is a big deal. It's a really big deal to be invited to the Olympic Training Center in Colorado. So she went, and she didn't believe she belonged. She just felt like she was an outsider, that she didn't actually deserve to be there. So she was there for a year before she actually decided that she was worthy, that she was allowed to be there. But what was interesting is once she decided that she was worthy and made all the decisions to become an elite athlete, she actually became the elite athlete. Now, she was good to start with, no question, because she got invited to the Olympic Training Center. But when she decided who she was and started putting her whole life in line with that, she became that elite athlete. And I think that's true for us too. Sometimes we go into our office and we somehow feel like we're an imposter, like we don't really know what we're doing. We do. We really do. But once you decide that you know who you are and this is how you want to practice and who you want to be, it becomes much easier to put your life in line. So I encourage you to take a minute sometime and just really sit down and think, who do I want to be? And who do I want to be for my patients, and who do I want to be for me? Because I think that does influence how you show up and how you make decisions about yourself. I watch way too much YouTube. There's this comedian. He calls himself The Machine. It's kind of raunchy, but you can watch it. But he tells this great story. And the story is that he was 22 years old, and he got to do a summer abroad in Russia. So he went to Russia, and the mob was running the Russia at the time. And so he became friends with the mob because he told them that he was the machine. And they invited him to drink with them, to party with them. He did, and then they ended up robbing the train, stealing a boat. I mean, he did all kinds of illegal acts. Now, in Russia, the police were like, great, come party with us. It was just a different world. But during the comedy sketch, at the end, he says, and as an adult, I can tell you, I made this decision that I didn't want to cheat on my wife. I was never going to cheat on my wife. But I had never thought about if I was asked to rob a train, if I would. And it's true. We don't think about those things. But he discovered that he was the kind of person that if invited to rob a train, he would rob the train. And so I couldn't help but think it's so easy sometimes for me to go with the flow, that if everyone is doing it, then I can just do it. It'll be fine. It's still not fine. It wasn't fine that he robbed the train, even though there weren't any consequences. It was still wrong. But he had to make that decision before he walked into the train. And those are things that you got to start thinking about. Okay, so what am I not willing to do? What is my line in the sand? And then draw it and keep to it. Because when you're in the situation, it's so hard to just say, no, I'm just going to go back to my cart. I'm not going to participate in this. When everyone around you is like, nope, we're going to rob the train. So this is my sweet husband. And again, more than a few years ago. He doesn't have any hair anymore. So I picked a great partner. He's wonderful. My office, I have a great team that surrounds me. And that just means the world, to have great people around you that support you. And when you say, this is my line in the sand, I can't do this, people around you say, okay, I get it, and I agree with you, and I'm gonna support you. That means a lot, picking good people around you. That means you have to invest in your team. You have to invest time, money, and some coaching. And I call it the culture of excellence in my office, because there's no such thing as perfection. There is not a culture of perfection, let me tell you, mistakes are made. But generally, my team helps me. So I put a crown in, I take an x-ray, and I'm like, oh, it looks great. And my team will be like, Dr. House, because they got my back. They're not trying to embarrass me or hurt me, they're trying to help me. In fact, they'll even say in front of the patient, oh, she's not gonna let that go. That's not gonna be okay. She cares way more than that. So they've set me up so that I can say, I don't like that, I'm gonna do this right. They've encouraged me. And just having that my back, so they're not embarrassing me, but they're encouraging me, and we're creating that culture of excellence so that we can do great work. Is it perfect? No, nothing is perfect. But I do think we do better work because of it. So this is a hard one. I've had a lot of tragedy in my life for some reason. I don't know why. This is my nephew. And my nephew came and lived with me in 2019 because his mom had passed away and his father was spending his life in prison. And he was the greatest kid. We did weightlifting because weightlifting is a metaphor for life. He was wonderful. We just spent a lot of time together coaching him, making him see that, he had opportunities that he didn't realize he had. We had a lot of hard conversations about his behavior, and it changed him. And it was difficult. He passed away in 2020 right after his 18th birthday, which just stunk. And it mattered. But as I look back, I have to tell you that the fact that I listened to him changed me. And the fact that his self-talk changed and my self-talk changed me. And sometimes that reaching out to other people, having the hard conversations that you don't want to have. I mean, it's hard to tell somebody your behavior is really out of the question today. But when you do that, then you have the opportunity to mentor and change people. And you have the opportunity to mentor and change yourself when you reflect on it. So how do you want to play big in dentistry? Anybody have any big dreams they want to share? Oh, come on. Nobody has a big dream? Tell me a big dream. I love that, an international lecturer. What else? Yes?
I want to be a national lecturer.
No, that's awesome. I don't necessarily want to go overseas either, so I like that national. But yeah, so it's a big dream. So how do you make those things happen? One foot in front of the other, right? Yes.
Also have to say it.
You have to say it.
You can be held accountable. I was just talking about that earlier this morning.
You have to say it. You have to be held accountable. That's part of the dreaming big. And it can be speaking. It can be running for office. It can be owning your own practice, whatever it is for you. Maybe you want to do more complex procedures, and that requires that you go to a continuing education that costs a lot of money. Maybe you want to be an influencer on YouTube. There's all kinds of things out there, but you have to decide, what does it mean to play big for you? And running through those ethical questions on, are these things that are going to help you and help other people? So it takes a lot of courage. So this is me. I think this is my first or second lecture. It's at UNLV in Nevada. And I was shaking the whole time. Oh my goodness. It was so scary to get up and speak in front of people. But it took me a little while to realize I had something to say and that I could help people. And that was those questions that I ran through. Am I doing any harm if I get in front of people and I mess up? They may laugh at me, but it'll be okay. Am I doing some good? Well, yeah, I have an opportunity to do some good. Maybe not a ton of good, but a little good. Did they have a choice? Well, actually, they didn't, but you all do. Was I fair? Was I honest? I was fair and honest. And I do think that's a big piece of it, that coming in and saying, yeah, nothing's ever perfect, but we try to be excellent. I think that was an important message, especially for dental students. And so I went in and did it. Did I stutter? Yes. I made lots of mistakes, but it was okay. It went well, and I just kept going. It's my dad again. If it was easy, then everyone would do it. And we all know that. Not everybody goes to dental school. Not everybody becomes a practicing dentist. Not everybody practices. It's hard. What we do is so hard. It's so detailed. And nobody except us really understands the complexity that we deal with. But the reality is, if it wasn't hard, then everybody would come out and do it. And that's why we had the degree. And failure is always an option, and it's just part of life. I hate those implants. They're not mine. But that happens. And how do you fix those problems? When I was a young dentist, I was part of the New Dentist Council, and I was having all kinds of issues in my private practice. Just because I couldn't speak to patients, I wasn't good at it. So I made a list of all the things that are wrong. I brought the x-rays. Now, this is before PowerPoint, so I've got a piece of paper. I asked 3 senior dentists, which is weird to think about that now I'm the senior dentist, but I asked 3 senior dentists to come and answer my questions, and we called it the good, the bad, and the ugly. So they came, and I passed out all my questions, and I just got up in front and said, so this patient has been with their dentist for 30 years. They came in, and there's all this subgingival calculus. They obviously need scaling and replaning, and they do not believe me. What do I do? And they were wonderful. They just gave me so much advice on what to say and how to do it. And suddenly I realized, okay, first of all, failure is an option. All of them had had failures. They admitted to it, and they just fixed it. That just like blew my mind. Crown didn't fit, root canal didn't go well. Just fix it, Allison. That was like revolutionary for me. And I think that's true in my life, though. It doesn't go well, just fix it. It'll be okay. So this is my friend Brett Kessler, who just won the ADA presidency. And it was a big deal because he's from the 14th district, which includes Arizona. And we're the underdog. We're not Texas, we're not New York, we're not California. So we're a smaller group. And so it's a big deal for him to win. And everybody told him he can't do it. He's too young, he's a Gen X, what is he thinking? He's married, he has a practice, he has 4 kids. 2 of them are still at home. What are you doing? And he still won. And I always think people love to say something can't be done until someone does it. So sometimes it can just be you that does it. Yeah. So yes, sometimes people say it can't be done, and she still did it. And it's working, and it's really cool. But it was brave. It took a lot of courage, and I'm sure there were failures and there were bumps in the road, but you just persevered, and it's really cool. And why? Because it did some good. I also think a little fun never hurts. This is my crazy family. This again a couple years ago, but that's my son and my daughter. My daughter is now living in Germany with Pebbles. And my son is here. He works for Access. He's an actuary. But we have a lot of fun. We play games. Both kids have worked in my office, and that was interesting. Neither one of them want to be a dentist now. And why? Because it's hard. What we do is hard, the level of detail. And they thought other things might be more fun, like math. Okay. So the conclusion is really, you use the 5 questions to uncover the answers. Should you do this? Is it a good idea? Are you helping people? Are you being honest? Almost every decision that I make, I run through those things, and I run through the moral philosophy of, am I doing the right thing here? And most of the time, the answer is yes. Every once in a while, I go, oh, I shouldn't do that. I really want to place this implant, but yeah, there's too many moral particulars for me to do that, so I'm not going to do that today. But someday, more training, whatever it is, I'm going to step into that and do something different and try something new. So I'm going to encourage you all to dream big. This is one of our athletes that worked out in our gym. And this is her competing at a national meet in, I think it was Peru. I think she's in Peru there. She's impressive. She's a little intimidating. We'd have these young men that come from football teams, and then she would outlift them, and they would be like, what just happened? She dreamed big. She took a chance, and she did it. And I think that it's magic when you do something you think you couldn't do, when you step in, you think about all the ethics of the situation, and you go for it. Do you have any questions?
I have a great question online.
Sure.
Use the mic so that. Oh, I can go around. Thank you. So, before we take questions, this has been an incredible presentation. Thank you so much. Thank you so much. Let me just pull it up here. That way we can't hear it without the mic. I'll bring it down a little bit. Well, it came on my computer. Okay, I'll read it from my computer. Okay, so Dr. House, this is so great. I think this comes from Dr. Lopez. I think ethics ties into social justice as it relates to access to care, especially amongst communities that have been disenfranchised, African American, Latinx, and Indigenous, and many others. Our primary ethical challenge as oral health professionals is to balance our individual needs and desires with our responsibilities to those who we serve. Besides direct clinical ethical decision-making, what can organized dentistry do to help disenfranchised communities promote social justice as it relates to the access to care and increasing representation in the field? So I know a heavy question, but as far as organized dentistry, I know ADA are taking steps. Is there anything else you can take from an ethical lens on what our responsibility as an organization?
So it's not as popular anymore, but I do feel like my degree is a gift because not everybody got to be a dentist. And so I have to pay it forward. Now, that doesn't mean that I have to go bankrupt. I can still have a good life, but I also feel like it's my responsibility to take care of patients. And so I do some charity work because I feel like that's important to give back. Legislatively, yes, that's a mess. But the cool thing is Dr. Brett Kessler is working on that. He works on a lot of disenfranchised patients, and he's very concerned about the access to care. In his state, Colorado, they fixed Medicaid so that there's a dental benefit of $2,000. So I would love to see that happen in other states. It's a great model, and I think he's going to push that forward. It is appropriate for us as dentists to be paid because we do good work and we care about patients, and we need to take care of people. I mean, that was part of the deal when you signed on. Yeah.
That'd be great.
Thank you.
Thank you.